2404, and I should have been with my colleague, namely Yordan Hagi Pamungkas, but right now he is having a little problem, so I will convey. What is coronavirus, and why called the coronavirus? Coronavirus is an virus that attacks the respiratory system. This virus almost similar with ACRS, which is only different from virus. The rule of coronavirus family name coronavirus because corona means crown, and this refers from the way that the virus looked under microscopy, like there's a crown on top of the virus. The first case occurred in Wuhan, China, December 2019. Then this virus spread around the world, and now this virus has arrived in Indonesia. How do humans get infected with COVID-19? This disease can be spread through small droplets from the nose or mouth when coughing or sneezing. Then the droplets fall into some object around it. If someone touches the object that has been contaminated, then the person touches the eyes, mouth, or nose, then that the person can be infected by COVID-19. Or someone could be infected with the COVID-19 when accidentally inhaling droplets from other person who has infected by COVID the virus when they are having a conversation. This is why it's important to maintain our distance between people around us. People who is at risk of being infected with COVID-19. 1. People who live or travel in area that the virus circulating is very likely to be at risk of infection. 2. People who has a low immune system. Of course, immunity is important for us to protect ourselves from virus, because the first thing the virus attack is our immune system, and then it enters and disturbs our respiratory system. 3. To other people who already have a story of other disease. A survey in China said that the older people who already have a history other disease such as heart attack and other will be more easily infected with the virus, especially for people who are paralyzed because they don't move much, and of course their immune system is very weak. Number 4. People who didn't maintain their distance when they are having a conversation. And number 5. People who doesn't use a face mask. What are symptoms of COVID-19? COVID-19 symptoms include 1. Cough. People affected by COVID-19 will experience a dry cough or cough with a phlegm. As happened in China, nearly 60% of the COVID patients in China experience cough. 2. Fever or chills. The fever that a COVID patient will experience is usually a high fever which can reach 37 degrees Celsius to 41 degrees Celsius. 3. Shortness of breath or difficult breath. Another system is that people affected by COVID will experience shortness of breath. Even in China, there are patients who get pneumonia because of this virus. 4. Headache. Number 5. Musical or body aches. The symptoms will happen after a few days getting infected. Usually patients will feel fatigue and pain in their nerve muscles. How to prevent being infected with the coronavirus? 1. Wash your hand. Always wash your hands using soap or a hand sanitizer after touching or holding an object to maintain hygiene and reduce the percentage of being infected with the virus. 2. Always maintain your distance. 3. Wear a mask. 4. Don't touch your triangle face, mouth, nose, and eyes. 5. Don't go out or don't leave your house. Number 6. If you have a fever, difficult to breathe, seek medical help immediately. The impact of COVID-19 on social life. 1. Self-quarantine. In order to reduce cases of this coronavirus, the government has self-quarantine for approximately 2 weeks and continue with PSB for 2 weeks. 2. New normal. Another impact is the implementation of a new normal, which means that everyone is required to wear a mask if they want to leave the house and comply with all applicable health protocol. 3. Education through e-learning. In order to prevent the increases in the COVID cases, the government in the various parts of the world, including Indonesia, are conducting e-learning where students learn at home via the internet. The psychological and economic impact in the pandemic era. Much of the research prior to COVID-19 linked thus a factor to depression, stress, sedation, talk. All data in us recently found that more than half of people who were unemployed or were sick was rejected during the pandemic had a reported negative mental health impact. The level is higher for those who have lower salaries. The psychologists emphasize that the unprecedented nature and scale of the coronavirus crisis added a layer of uncertainty compared to previous financial crises. Until there is a global vision, it remains unclear when or even if some of the hardest hit industries, such as travel and entertainment, will recover. In addition to negative impact, there are also positive impacts during the COVID pandemic era. 1. People become more public awareness and discipline of the importance of maintaining cleanliness and following health protocol increasing. 2. Next is more alert. The emergence of suspicion among health workers for fear of spreading it to one another. This is actually good because it makes health workers more alert and protect themselves. 3. The life of health workers is more organized. Number 4. Public awareness in sport. Okay, maybe that's all I can say less and more. Sorry.